Hi there. Welcome to STAT's virtual event, Preventing a Black Market for COVID-19 Vaccines, sponsored by Ignite. Thank you for joining us. I'm Nick St. Fleur, a Knight Wallace reporting fellow here at STAT. And in just a few moments, I'll be joined by several experts to discuss the potential for a COVID-19 vaccine black market. Where are we already seeing unethical behavior, and what can be done to prevent it going forward? But first, a few housekeeping items. At the bottom of your screen, you should see a few icons. There is a chat icon and a Q&A icon. Use the chat feature to talk to each other or to send a message directly to the STAT team, labeled as STAT events. But do not put your questions for us in the chat. In the Q&A window, you should also be able to see the questions that other attendees have asked and upvote the questions you would most like to see answered. We will be taking questions throughout the chat, so please don't wait until the end to submit. This is part of what makes these events so special. Thanks again to you all for being here. Before we get started, I'd like to welcome Alok Tayi, Vice President of Life Sciences at Ignite, for a brief introduction of today's event. Take it away, Alok.
Nick, thanks so much for the introduction and for the opportunity to be here. As you know, my name is Alok Tai. I'm the VP of Life Sciences here at Ignite. We're proud to sponsor today's event, as well as participate in the dialogue. I think it's safe to say that as a society, we've experienced a tremendous amount of difficulty through COVID over the past year. It's forced us to change the way we live, the way we work, the way we play. And there are billions of people globally who are all depending upon how these new medicines and vaccines come to the forefront in order to enable us to get back to our daily lives. And I think the industry as a whole has truly stepped up as a industry to help identify and develop these new vaccines and bring them to market at an unprecedented pace. Whether it be the pace of development, the pace of manufacturing, or now the administration and deployment, we've seen the clip at which we've been able to bring multiple vaccines to the forefront at a pace that we've not seen in modern time. And so I think in this circumstance, given how fast we need to move, the import with which we are developing these new compounds, it's particularly critical that we ensure and drive towards maintaining trust amongst the populace and trust amongst patients. Whether it be trust in the data, trust in the product, or trust in the administration of those vaccines, ultimately at this juncture, we have to be really focused on ensuring we maintain that trust amongst everyone. And in our view, as a software company, we've seen a lot of opportunity to think about how software and technology specifically can help support the industry and the development of these vaccines, and especially in terms of today's topic, ensure that people can trust what they're receiving. And so I think from our perspective, that comes back to a concept that we describe as data integrity, with a key component of also data security that weaves itself through how we operate as an industry. I think one of the most recent events prior to COVID that has also brought this topic to the forefront has been some of the challenges with Zolgensma, where some of the challenges and issues observed with data and data integrity has then led to subsequent questions about the medicine and its commercialization thereafter. However, in the context of COVID and the vaccines we're looking to bring to market, we see data integrity as a critical theme that we should be trying to strive towards in order to help prevent some of the issues that we're going to be talking about today, like a black market. This could include enabling folks all across the globe to be able to manage their data and documents in ways that enable them to maintain compliance, collaborate, and have a true understanding of what's happening with their materials. And so one of the challenges we've seen emerge along this new world is the fact that the mode of which we develop new medicines and products in the life sciences industry has evolved even over the past year. How do we maintain data integrity over the coming years and decades, given how distributed and outsourced our processes are? In our view, we see technology as a critical foundational part of enabling the life sciences industry to maintain data integrity and therefore provide trust to patients about the medicines being developed and being delivered. We see that really translating across three key domains, whether it be in the context of clinical trials, especially those that are being performed in a virtualized and remote context with remote monitoring. Thinking about manufacturing and distribution, which almost by definition has to be a global activity. But then also thinking about the interinstitutional collaborations and partnerships that have to be pursued in order to support the organization to bring those medicines to market and facilitate its administration. And so from our vantage point, we're seeing this context of data integrity also play a role when it comes to not only compliance with FDA-oriented regulations, data privacy, when you think about global data regulations, but then also conventional challenges like ransomware as impeding the ability for us to bring new vaccines to market. And so ultimately, the best practice that we've seen emerge over the past year has been to take a different view on how the company operates and how data and documents are managed. A key theme here that we believe is relevant is one looking at the centralization and control over data. And so in this circumstance, systems and technologies that help support how organizations operate, whether it be through collaboration to facilitate the flow of that data and knowledge across different parts of the supply chain. The second is ensuring compliance, especially with FDA and EMA and other regulatory authorities' requirements. But then also thinking about the capabilities, whether it be the visibility one has into what's happening with their programs, but then also things like analytics as well to drive the next generation of development. We see truly that enabling medicines to be brought to market at the pace that's expected, ensuring that people can trust those compounds, really requires that we look fairly closely at how we maintain both data integrity and data security. So hope this is a good sort of overview from our vantage point, and would love to turn it over back to the STAT team for today's discussion. Thank you so much.
Wonderful. Thank you, Alok. So before we begin, my colleague Olivia Goldhill is working on a story about doctors who may be putting friends or relatives onto their staff so that they can falsely present them as healthcare workers. If any of you have heard anything along these lines, please reach out to us. We're also looking at any stories pertaining to people who might be traveling across state lines to get vaccines. So if you're looking to contact my colleague, her name is Olivia Goldhill. That's olivia.goldhill@statnews.com. And you can just reach out to us if you happen to have any tips or even put them in the chat. Now I'd like to introduce our featured speakers for the remainder of today's event. Please welcome Dr. Allison Bateman-House, Assistant Professor in the Division of Medical Ethics within the Department of Population Health at the Grossman School of Medicine at NYU Langone Health. Glenn Ellis, a visiting scholar at the National Bioethics Center at Tuskegee University and Bioethics Fellow at Harvard Medical School. And Dr. Nikos Pissas, professor in the School of Criminology and Criminal Justice at Northeastern University. Thank you all for joining me today. As a quick reminder to all of you guys watching, if you have any questions, please use the Q&A feature at the bottom of your screen. So now to start us off, I'll be asking Nikos a little bit about what it is we're seeing out there as it pertains to the black market, to vaccines. What are some of the things you've come across?
Hello, good morning and good afternoon to everyone. Thank you for having me on. The kinds of things that we see is typical of what emerges in emergencies. And that is unregulated and unregistered exchanges that affect the quality of care and the quality of medicine that we have. What we see is, for example, diverted, stolen, falsified, and substandard products that undermine the public health of the people, the health of the people who take it, the public health in the community. They damage the brand, they cause economic losses to the company, and they torpedo the efforts of the government to get the economy up and running. So these are illegal acts that we see with vaccine tourism, with fake medicines, with fake products. with multiple victimization. But the key thing that I also see that concerns me, and it's a broader point, is a combination of market forces and state actions and inactions that shape the environment in which we are and produce externalities that affect usually the more fragile communities, the underprivileged and developing countries. What we have seen is market forces and industry priorities affect the preparedness, the readiness of the international community for coronaviruses and epidemics like the one that we have. We have seen how state inaction has created these mismatches between supply and demand for PPE, for tests, for vaccines. And we have seen even what was called by a European official state piracy, when one country was going to pick up goods that were intended and paid for by another. We see currently in the European Union the authorization of national agencies to block exports of vaccines. We have seen vaccine nationalism. These are the kinds of things that prolong the pandemic, undermine public health, cause security concerns, and affect, and in the end, represent also constitute institutional racism. So those are the kinds of things that trouble me, worry me, and I hope that we can find a better balance between what governments do and how they interact with the public, with the private companies and broader society.
Thank you so much, Nikos. A question I have for Allison is, people might be wondering, why does this matter? Why should we be concerned about, a black market when it comes to the vaccines? And also, what is it we are trying to prevent?
Well, so remind me to come back to that, because first I want to problematize what you just said, simply because I think we need to define what we're talking about when we have this conversation about black market. So Nikos just said very properly that, this is normally talking about, unlawful activities. But keep in mind, a lot of what's getting pressed in the United States are things that are not necessarily unlawful, even though they are unethical. So, putting your wife on as a temporary member of your practice so that she qualifies for the drug, I'm not sure that that's actually contravening a law. If I were to take my parents to a health clinic in a minority owned part of the city, that sort of contravenes the intention, which was that we were going to make those vaccines accessible to this, minoritized population that might otherwise have less access. That's unethical, but it's not necessarily illegal. So I just want to break it down and say we're sort of, going back and forth about the two. And of course, to get back to your question about why is this a problem? Well, anytime you break laws, that's a problem. So I'll set that aside and say, I think Nikos had a really good point, which is that when you start having these sort of fractures in the structure of provision, whether it's healthcare or some other medical good, you start engendering a lack of trust in the system. And at this point in time, we're already dealing with a vaccine that was the fastest vaccine ever created and brought into production in human history. There are a lot of people out there who actually are authorized to use it right now, but are declining because they have this hesitancy, just saying, wow, it was so fast. I'm not sure it was fully tested. I'm concerned. You already have this very tenuous situation, and anything you do further to sort of undermine people's trust in provision, or who's going to get it, or who's going to get access appropriately, or, is there some chance that maybe this vaccine was not, properly guarded, and now maybe I'm getting a vaccine that's no good. Anytime you have situations like that, it's just, going to cause more problems. So I think that's sort of a very practical look on why this is a problem.
Thank you so much, Allison. And then I'd love to pose a similar question to you, Glenn. Tell us a bit about, what are you worried about as it pertains to, the vaccine rollout, a potential black market, especially the impacts on marginalized communities?
Well, I guess at the top of that list, and there's a list of concerns, I wouldn't call them worries necessarily, but at the top of that list would be when we talk about black markets and the impact and how that plays out in those type of marginalized communities. I think we have to start to think about the integrity of the actual product that's going to end up in those communities. So just by virtue of some assumptions we make about what we're talking about when we say black market, so we're talking about unregulated, uncontrolled distribution of these products for a fee. So that means you now are wrought with opportunity for there to be contaminations, different types of breakdowns in the integrity and quality of what it is that people are going to get. We've seen that play out with knockoff on designer bags. We've seen it play out even in the drug industry and the drug trades, that how the illegal drug trades rather, that there are contaminated products being sold out on the street, supposedly representing something else. So I'm concerned about that. I'm also concerned about just on the black, when we talk about black market, particularly just using the Pfizer and the Moderna vaccines as an example, to think about, so where's the integrity of the refrigeration and the storage protocols throughout this black market process? So now we're going to create a whole nother possible public health issue within these same communities that we've already seen historically, bombarded with these disproportionate burdens of these chronic conditions. So now we're opening up the Pandora's box for another potential opportunity for those type of destructive and devastating patterns that exist in those communities. So I'm very concerned about that.
Great, thank you. And a question for all of our panelists here is a bit about, what is it we are really trying to prevent, and what is your advice on, how we should prevent this? Should there be fines for line skipping? Should there be, what kind of rules should be put into place right now? And what rules are we not seeing?
If I may just quickly respond to that, if the other panelists don't mind, I just want to say that I think that what we have to be prepared and really pay attention to right now is our willingness to compartmentalize the issues around this black market with the vaccine and not understand how that plays out systemically in our healthcare and medical system. Mm-hmm. So I think that's a real core focal point for us to understand. I think we make a drastic mistake to not understand that what we're seeing about the potential for this blossoming black market with these COVID vaccines, what we're seeing should be enough to give us an indication that we need to look at the entire system, to look at where are the breakdowns in the system to facilitate preferential treatment as well as exclusionary treatments.
Can I just respond to that and say, I want to agree with Glenn and say, we know that there are social inequities in who gets access to medicine or medical care or healthcare in this country. And so it would have been, totally unfeasible to suddenly say for this one product, we're going to have an equitable allocation of drug with no problems, simply because we don't have that system available. So when you see stories now of people saying, can I go to a concierge medical service, pay $20,000 to get, priority access to the drug? Well, why wouldn't they? They're already able to pay a fee to get premium services for everything else. So, I think we would have been very naive to think that this was going to roll out without problems. So now to get back to Nick's question, now that it is rolling out with problems, what are we most worried about and what can we do? So I'll just say three things. I'm most worried about waste of vaccine. The vaccine that we have at the moment is incredibly scarce. It's very precious. I'm really worried about waste of vaccine. And that would be a long discussion about how to try to prevent that. I'm worried about egregious misconduct, because I think if there are these situations of egregious misconduct and they're not met with more than just sort of a shaking of the head or a slap on the wrist, it will embolden others to do the same. So I think in that case, we really need to rely upon naming and shaming and actual meaningful penalties. And then last, but certainly not least, I'll go back to what I said earlier. I'm really worried about furthering the sort of already present mistrust. So those are my concerns.
Well, to go back also to the beginning point for our session on data integrity, I think integrity and good governance is the key overall. trust in science, trust in institutions is important. And for that, we need not only data integrity, but also data transparency. We need to have publication and sharing of the data, particularly on adverse effects. That is what strengthens people's confidence, and then they are stretching their arms in order to get vaccinated. So we need to have openness and ensure that this information is shared. We need science with conscience. At the same time, we need to have a collective effort and understand that the pandemic can only be resolved when the entire global community is inoculated and protected. Vaccine nationalism and protectionism against what is supposed to be a market, but it is not a market condition. It's actually the right of the most powerful nations and governments. So we need to have a collective effort to ensure that we have a global implementation, a plan and its implementation. And we need that to be based on science, on facts, devoid of misinformation and disinformation. So we need a collective conscience with science. So science with conscience and conscience with science. If you take science out of conscience, you're left with a con, and we're very vulnerable to it.
I appreciate that. Thank you so much. A question that I know many people are, struggling with, and Allison, you had touched a bit upon this, vaccine waste. We've heard stories about people being in pharmacies at the right place, right time, and a pharmacist says, hey, we're probably going to throw this out unless you would like to be vaccinated. What should people be thinking if they're in that situation?
I mean, I can only speak for myself. I'm sure there's actual guidelines out there, but if it's closing time and the pharmacy says, I'm going to throw this away, or you can get it, would you get it? I would get it. I would say, it doesn't matter if I'm not the right priority group or not, because, I would like this at some point and they're going to throw it away. And I am, helping public health. I'm helping to get to herd immunity, where we're going to protect all of us, just not only those who receive the vaccine by taking this vaccine. Now, I have logistical concerns. If you have these 2-shot vaccines and you only get 1 shot because they're getting ready to throw one away, what does that do for you in order to be able to get your second shot? Do we know, if you get your first shot now and then you have to wait months till you can get your second shot in your normal priority queue, does that do you any good? I mean, there's lots of practical concerns out there, but ethically, I would tell someone, if they're in that situation, please just go ahead and get it, and don't hold yourself accountable for, the flaws of the system rollout. But what I am worried about are people like my parents. I have elderly parents. They're in Virginia. They are on numerous wait lists for the vaccine and have not been able to get an appointment. And so at this point are literally spending their afternoons calling pharmacies trying to see if there's any drug going to waste. That is not a good use of anybody's time. And of course, they're retired and have the time to do it. What would happen for someone who's still actually working, or, caring for a family member or something? So that just, perpetuates the inequities all over again. So.
Can I just jump in real quick? I wanted to say a couple of things. I'm sorry, Nicholas, did I cut you off?
No, please do.
Okay, go ahead, Glenn.
You sure?
Yes.
Okay, so I just want to say quickly. So I think there are a couple of things I want to point out. One is, when we talk about what can we do to prevent the black market, we can pay attention to the economic impact in some of these impoverished communities that makes vaccine black market a viable source of income for people to take care of their families. So now we're opening up the door for another opportunity that speaks to crime and law enforcement, in terms of people breaking into pharmacies, or somebody works in a medical center and they know where the cabinet is or the freezer room is, or whatever. So I'm just saying there are a lot of dimensions to this notion of a black market. So it's not just at a very high level, level with concierge practices, there's a trickle down effect that it permeates every aspect of our society. And so I think we need to understand that. And the second point I want to say very quickly, I think a part of this conversation needs to acknowledge the extent to which we're sitting in the wealthiest, most powerful country in the world with the most expensive and most advanced medical and healthcare system in the world, in world history. And we're talking about a Black market that would exist only because of a scarcity of supply. And this is one of the core aspects of my approach to ethics in medicine, is to say, we can't ignore ethical violations all along the process, only to find at some juncture in the process, we now want to apply ethical standards to it. But we have allowed the federal government to use public funds to fund research and development of a vaccine for use in the general public without any consideration for how it's going to be distributed widely to everyone. The considerations in research and development made sure that it would apply to be a fit into the existing system that advantages certain people. I mentioned in one of our conversations prior to this call that we have communities around this country where you can't go into their local grocery store or corner store and buy ice cream out of the frozen section, and it's frozen. So there is no infrastructure that exists widely in this country to make sure there's proper distribution. Again, another enticing invitation to create a Black market. So we have to look at the whole process, not just what we could need to do about the Black market with vaccines, but there are a lot of extenuating factors that contribute to why there is an opportunity for a Black market in the middle of a deadly global pandemic.
Could I make just 3 quick points, starting with Glenn's point about, well, let me just say first on the question of the U.S. being a most powerful and strong state. We were able to find trillions of dollars to bail out industries and support financial markets. We can't find $1 trillion to make sure that health is a human right and everybody enjoys it. So those who are about budget conservatism, they threw that away when it came to the financial markets, defense industries, airlines, and so on. And now they are remembering it when it comes to public health. That inconsistency needs to be addressed. Secondly, the point of, I'm in favor of compliance beyond the law. We have to look at basic ethical principles that guide company and government activities. But even the law in this area of illegal, falsified and substandard medical products is inconsistent and inadequate in many parts of the world. That undermines international cooperation. It gives a slap on the wrist in many instances where somebody in India, after a very substantial seizure was made, was fined something like $26. That's not deterrent, okay? So we need to fix the legal framework also and the ethical principles behind it. And on the wastage, again, the most powerful country in the world ought to be able to better coordinate its effort at the national level rather than leave it to localities to decide what happens when we thaw the vaccine and the people who were first online didn't show up. Some states have these priorities. In other instances, you get stuck in the snow together with the ambulance going with a vaccine, and you get vaccinated because otherwise it will be wasted. People come up with innovative ways of making sure that vials do not get thrown out. But the problem is that you have thousands of vials that do get wasted. There are reports about more than 3,300 in Florida in today's newspaper. Some more, and the states report that the CDC I hope we can have this data at some point because I couldn't find it anywhere on CDC's website.
Mhm. So a question I had from the chat here. This is from Christina Campbell. She's saying that she's getting a lot of questions on how to track and verify that people have had both doses of the vaccine, if necessary. And she's curious about, what platforms will be used for proof. A question that she has is like, how will this be integrated across the board, across borders and such? So, what are your views when it comes to, tracking and verifying that people have received both doses? I know, Allison, you had mentioned a bit about that, and it's funny. I just wrote a story today about parents, about people trying to get vaccines for their parents. And in reporting, I came across a case where someone was able to get one dose, but they're having a lot of trouble trying to get the second one. So any insight on, tracking or when it comes to making sure people get a second dose?
Well, I mean, I'll just give you as an anecdote because I cannot answer your question. I'm not a software person. I'm not a technology person. I'm not a blockchain person. I can't tell you what platform will fix this. I know lots of different ones are in use, but I'll just give you an anecdote. I work for a hospital system. I got my vaccine through that hospital system. I am also a patient of that hospital system. So I'm simultaneously through my chart getting notices about, you need to come back for your second vaccine. Don't forget your second vaccine. Have you scheduled your second vaccine? And getting notices that says, don't call us, don't call you because you're not prioritized for this vaccine yet. So if in one hospital system, it's hard to keep track of, do they know who I am and if I meet the criteria or not? You can only imagine how much more complicated it is as soon as you go outside of that hospital system and start working. I'm just thinking about my parents. I think they
Mhm.
probably see 6 different medical providers, and just trying to and again, they're retired. They have time, they have the internet, they're English speaking, they have insurance. I mean, they have everything that you could possibly want to be well positioned in this situation, except for, of course, the concierge medical, specialty boutique, which they don't have that. But they have everything else. And if it's this hard for them to navigate, how in the world is someone who doesn't have those advantages going to do this? So I agree with Nikos. We really, really, really need governmental support. I mean, we
Mhm.
cannot do this without governmental support. And whereas traditionally and legally and historically and everything else in the United States, public health is a locality issue, we really do need national guidance at this point, simply because, it's already such a patchwork and we can see the difficulties that are coming of it. We really need some, overarching guidelines to help.
Well, I think excellent points, Allison. And I also think, furthermore, that we need to also recognize the extent to which uh, how disjointed and fragmented our healthcare system is. So even if there is some miracle platform or software that could do it, we don't even have a system to actually capture the data. We're not even able to collect racial data. We don't really have, and every state, I mean, so we gotta, once again, I think it's important. We do a disservice by not acknowledging, based on what's been illuminated throughout this pandemic. And this episode with the black market and vaccine is one aspect of what we have been blatantly shown throughout the pandemic. We have to look at the deficiencies in our system. We can't even collect enough data to know who has and who hasn't. We don't have accurate ways to collect data to even then decide what's the best platform to really house it. We don't have it. So I'm saying let's make sure we understand those things.
Thank you
And
so much.
can I just say, ideally during the, amazing Operation Warp Speed, which I'm not taking anything away from the scientific achievement, ideally equal attention and money would have been spent on all these logistical issues because the best vaccine in the world does no good until it gets into people's arms in like, the actual approved vaccination schedule. So we should have had a whole other part of Operation Warp Speed on, how do we build up people's trust in this vaccine? How do we set up the logistics? How do we get, the authorized, nurses or phlebotomists or whomever it is that we need? And we did not do that.
Mhm.
And addressing the fragmentation, just as we need an all of government response to crisis, we need an all of science response to social problems. And an opportunity that we have right now with support from the National Science Foundation is an initiative at Northeastern BU and the University of Houston to have computer scientists, pharmaceutical scientists, bioengineers, social scientists, and lawyers work on the detection and disruption of illegal supply and distribution chains. So applications for big data analytics, all these dashboards and apps and things and better detection techniques, uh, better navigation of big big data online and the dark web and so on. Those are the kinds of things that anyone can approach us, and we'll be happy to respond.
Mhm.
But it has to be something that that links. It's an opportunity, not just a challenge and a problem. Crisis give us an opportunity to come up with a better governance model, where you actually do provide scientists from different disciplines the opportunity to give you answers, to give you solutions, not only applicable to the current epidemic and crisis, but beyond.
Right.
And I just say, I'm sorry,
Mhm.
because we haven't said this yet, and I think we have to say it. So, public health in the United States has been systematically defunded
Mhm.
for decades at this point. I'm in my 40s. I've worked in public health most of my adult life, and it seems that there's always a quick flood of money in when there's a problem, SARS or, H1N1 or the World Trade Center, afterward, the environmentally caused cancer spikes. There's always this flood of money in, and people always go, wow, we learned our lesson. We really need to have a strong, robust public health system. Glad we learned that. And then within, 5 years, the money disappears again. The workforce is decimated again. And then we have to start all over again. So, it's really shame on us that we haven't learned this lesson myriad times over.
So the next question comes from one of our submitters. Gary Pierce is asking, the poorest countries in the world are completely excluded from high quality vaccines. How will they avoid this catastrophe and avoid being sucked into the black market?
I'm waiting to hear the answer to that.
One,
I want to hear the answer to that question because I don't know that they can.
I wouldn't say they're completely excluded. I mean, there's got to
Yeah,
be
right.
other organizations out there that do yeoman's work, but I mean, they're certainly being put
For all practical purposes, they are excluded.
at the end of the line. And as Nico said earlier, this is a global issue. So, it doesn't matter how well you vaccinate in the United States, unless you hermetically seal our borders, there will continue to be influx of the virus and new variants and what have you, unless we take this as a global challenge. So, I mean, it's a huge issue.
And then when you have, and it's compounded when you have situations all over the world in Western countries where people, like for example, Canada has 9 times more vaccines than they need to vaccinate the entire population of Canada. They've got 9 times more just to make sure they're not going to get. So look at what that does to deplete availability somewhere else. So I'm just saying we have to understand what systemically we're doing around the world in respective countries and collectively to create the conditions for a black market. And we can't just focus on what are we going to do to deal with this black market? How did it start? What's the cause? We're talking public health and medicine here. You can't treat a condition unless you fully treat it. All you can do is address the symptoms unless you're really committed to trying to treat the condition. Now, are we going to treat symptoms or are we trying to treat the condition? That's the question here. Who is it that we want to be as a society? Not how we can keep putting out fires like black markets with vaccines and that kind of thing.
so this is a kind of worms. During the pandemic, the 10 richest people in the world made enough money to pay for the vaccination of the entire planet. That tells you something about what kind of international community we have. And it's not only Canada, it is also the UK, it is also the United States that have options to buy many times over the proportion of the vaccines for their population. And according to some calculations, there are certain countries that are not going to get the herd immunity for 5 years. So there is a UN initiative, there is a WHO initiative where it is a joint effort between industry, governments, and international organizations to find ways in which an equitable way of offering quality vaccines to everyone can take place. The United States was not part of it. The new administration said it is joining this effort. So this is to be applauded. But the minute the Europeans or the North Americans feel that they're not going to get enough vaccines, they start blocking exports or taking the share of others. That is the kind of protectionism, that is the kind of vaccine nationalism that gets in the way and undermines the trust that we need to deal with these kinds of problems. And we're making the same kinds of mistakes with climate, with education, with all kinds of social problems. Just as you cannot have a corner in the swimming pool for a toilet, you cannot have protected communities against the pandemic or good environment when other parts of the world are polluting it. Those are common problems, and the common interest has to be prioritized, and a better balance between market forces, the role of the state, trust in government, and the role of civil society needs to be worked out.
So I agree that we're looking at, a huge issue that is much larger than just vaccines. I think vaccines is the tip of the iceberg in terms of lack of equitable distribution of all types of goods, not just medical. But I want to say, when I said earlier, one of the things I was concerned about is egregious misconduct. And if it's not checked, I think it might actually predispose others to behave poorly as well. I think even before we fix this massive a ball of yarn that we have to untangle and somehow fix in a more sustainable way. There are current situations of egregious conduct between nations, and those really need to have the force of law or public shaming or something brought to bear to try to stop that. And so what I'm talking about here is, I think many people saw the case in the New York Post about the wealthy couple who flew into the Yukon and misrepresented themselves as being local hotel workers in order to get vaccine that was intended for indigenous elders. I've been in touch with reporters who say that they have seen travel packages either taking people from London to the United Arab Emirates to get vaccine and then back to London, or alternatively from the United States to India. In situations like that, I think we really should have zero tolerance and nip those in the bud as quickly as possible. It is in no way, shape, or form the sustainable overhaul that Glenn and Nikos are properly talking about. We need that, but I think at a very minimum, we need to respond very strongly to this incredibly egregious conduct, so that it does not, lead others to be like, well, if they got to do it, and that sounds like a pretty good idea, why don't I do it?
Mhm.
I think you start small because, there are a couple really egregious things we need to address, but then there is obviously this much more, multi-year, sustained, much larger than COVID vaccine issue of who gets access to what, when, where, and why.
Hey,
One
Nicholas,
quick point is,
I'm sorry. I just
Go
want
ahead,
to
Glenn.
quickly. Someone sent me a message and said I had put incorrect information about Canada having 9 times more. So I'm sure, Nicholas, you can appreciate as a medical writer, you got to defend your facts, right? But anyway, I just want to let them know that as of December, Canada had 4 times as much, December 7th, and it's all reported in Bloomberg. But they had 4 times as much as they needed. Then they placed another 20 million before the end of the month, and now they have acquired access to 9 times as much. So the facts are accurate.
Thank you for that, Glenn. Nikos,
so-
you were about to add.
one thing to add is that when it comes to illegal and criminal behavior, we can all agree, and that's the low-hanging fruit on what needs to be done here. Maybe we need to adjust also penalty sentencing and enforcement practices for consistency. But worse than everything, as Alison and Glenn have been also pointing out, is things that are not breaking the law. It's the lawful but awful kind of practices that we have in place. When our attention must be focused on what the effects of certain practices are, rather than whether they comply or do not comply with the law. That's one standard. We agree with that, but let's look at what we are doing, because some of these practices are worse than organized crime. And when they are so harmful, we need to do something about it. It's a matter of public policy. So yes, it is allowed to go out and book 5 times your population for vaccines. Is it all right? And does it help you? Is it really to the best interest for your society, for your economy? Is it sustainable? Once we look at effects and consequences, I think we can find some more consensual arguments, facts, and knowledge.
Thank you so much for that, Nikos. I'm turning to a question from our audience right now, one of our most upvoted questions, and I'd love to remind our viewers that if there's a question in the chat that seems interesting to you, please feel free to upvote it. So Lena Jeweler asks, Richard Thaler proposed a system whereby wealthy individuals could bid in a lottery for access to vaccine doses, and the money would be used for a social good, such as purchasing vaccines for low-income countries. Is this sort of proposal a reasonable, practical response to black market activities, or does it simply justify or perpetuate structural inequity?
I don't know if that's the piece that was in stat, but I mean, in stat, there was a first opinion piece saying, why don't we let it go to the highest bidder and then use that money to do good? And sure, that's a reasonable response. I actually don't like it though, because one of my major concerns is engendering a lack of trust in, public health and governance overall. And I think if you take something as crucial as COVID-19 vaccines and put it on the block for the highest bidder, you have effectively, said, there, that's what it is. We're in a society where money buys access, and there's no other sort of protocol by which we go by. So I actually think the social costs are worse than it would be to go ahead and do that to make money. But I mean, yeah, it's a reasonable proposition. I just don't support it. I'm interested.
Just one reminder here is that we may have big manufacturing in certain parts of the world, but we have a very diverse supply chain and dependence for more than 80% of the primary ingredients for making all these drugs in other countries. So if those countries are left out from the final product, they may turn around and say, well, you're not getting the APIs, you're not getting the primary contract. You don't want to get into this kind of environment. You have to understand the interdependencies and the common interest that is here. I think that is a better pathway.
Great. I'm turning to another question that we have here from, one second. We had a question having to do with how do we, here we are, from Christina Campbell, asking, are there any comments about communities that are very wary of trust? She provides the example of Africa due to counterfeit malaria products coming out of China. I know we've talked about trust issues here in the United States as well. So her question is, how do we ensure the supply chain, the distribution, the communication engenders trust in developing countries and emerging economies? And I'd love to also extend that to marginalized communities here in the US.
Well, if you do not communicate with integrity and honesty, you're going to have mistrust. Mistrust is about a perception of corruption. And when that perception is backed up by a reality, you got a real problem. You have to change the reality. So in some ways, that's where we have to work on. Better communication, being straightforward and being open about this, open data and about adverse consequences, about precautions, about the tests, about the appropriateness, and so on. When you trust people, they trust you back. This is a two-way street, and you cannot. And that is part of the challenge that we have here. When you have confusing and contradictory messages that are coming from official sources. That is a serious issue that needs to be addressed. When it comes to developing countries, there have been past experiences that leave room for improvement about disclosure, about proper consent, about access, about pricing, about differences between generic industries and big pharma. Those are issues that need to be addressed, and this is the opportunity to do it. In crisis, I think we can find a better way of dealing with that. This is why the international community actually stopped using the word counterfeit for drugs, and they use substandard and falsified now as a better descriptive term to find out where we can find an agreement and a common language in order to talk about these things. But that's how you build trust, through joint efforts.
Let me add another dimension to that, if I may, Nikos. Um, First of all, I want to reverse the order of what you said earlier. Trust is the result, for many of us, the result of our experiences, which then shape our perceptions. Not the perceptions would then become reality. Mistrust for us is based on our experiences, our realities with healthcare and medicine. And then it has shaped our perceptions about things as we encounter moving forward, because nothing has ever taken place to validate our realities. And instead, it's been made to think, it's been minimalized.
I entirely agree with you. That's why I said that perceptions are backed by reality. If you have a wrong perception, you change the perception. But
And I got that.
You change reality. You are at Tuskegee University. The Tuskegee community knows one or two things about scientific misconduct.
But it's not just localized to Tuskegee. That emanated all around the world for many of us, right? And so once again, my point though is that we have to address what the hesitancy is really focused on. And there's hesitancy for different reasons for different people. There are people who are into the 5G thing. There are people who are into like back to nature and I don't put any kind of chemicals in my body. And then there are people like us who got a totally different legacy and history of mistrust that's based on something that is unique only to Black people in this country, right? And so what we have to do is understand that there are different silos of mistrust, and there is not just one mistrust. Some people think that you address mistrust by just educating people about what a virus is. That does nothing for what I know about Tuskegee's, the experiment that the United States government did. Let's not forget that. We keep thinking that it's just like a bad clinical encounter. So when we talk about mistrust, we got to go back and look at what is at the core of the causality of this. That was the United States Public Health Service that conducted that. So what we have to do is acknowledge the silo nature of the communities of mistrust and not think that there's a one size fit all to addressing this.
Which is really why I think we failed by not doing a simultaneous Operation Warp Speed in terms of saying, find community leaders, find, journalists, find, faith leaders, find, whoever in whatever communities are possible, learn what those silos of mistrust are, learn from them what would be convincing evidence, and then start down that path of trying to, and you're never going to convince everyone, and so that raises the question of, do we mandate this at some point or not? But, even before you get to that question, you try to meet people where they are and address fears or concerns or whatever it is, and we failed to do that. I mean, there's no way to sugarcoat it. We failed to do that.
And I need to say this on that note. Thanks for that opening, Allison. I need to go as far as to say we have spent 40 years with the HIV/AIDS process. Do you think at some point NIH and Dr. Fauci would have realized what Allison just said? Do you think the CDC would approach pandemics in a different kind of joint public health, clinical, medical research kind of fashion? Instead, we keep trying to make the same broken, deficient system work. And then when some part of it blows up, like this vaccine situation now, we just want to focus on it instead of realizing there are bumps along the way. How could we go into a pandemic after just coming out of a 40-year pandemic, seeing what happens in disproportionately marginalized communities of color, that are still experiencing epidemic levels of HIV/AIDS, to realize we should have had some kind of public health component. You can't talk about Operation Warp Speed and put 100% of the resources into big pharma. And now want to talk about how we stop a black market with vaccines. We missed that boat.
This is why we have to see this crisis not as a roundabout where we just go around and we come back to the old normality. This has to be seen as a gate through to a better society. That's the opportunity that we have to fix some problems that are now exacerbated.
I wanted to thank you all so much for your time. We are at time for the panel, and I think that was a wonderful way to close, just all of your remarks right there. So with that, I think we're about at time and need to wrap things up. Thanks again to our event sponsor, Ignite, and thanks to Allison, Glenn, and Nikos for joining me today. A big thank you to all of you out there for attending and asking some really great questions today. Keep an eye out for some more STAT virtual events happening soon, including next month's events on addressing the crisis of antimicrobial resistance and examining the pandemic's toll on mental health. More information can be found on our website. And until then, stay safe and be well. And if I could just make one more plug for my colleague, Olivia Goldhill, who is doing a story looking at any kind of doctor's office or physicians where they are putting family members or relatives, in order to say that they are, healthcare workers. If you have any tips on that, please feel free to reach out to us as well. Thank you again so much for your time, and please, everyone, stay safe.